Okay, my watch is 12:32. I think that we should start our info session. So first of all, welcome everyone taking your time to join the Institute for Pandemics ISI's information session. My name is Nelson Lee. I'm the academic lead of this ISI. And this is actually the second of two identical information sessions being held in February this year. Just to go back a little bit in time, actually in late 2022, the Institute for Pandemics was officially approved as one of U of T's ISIs. And it's been a long while since our previous consultation sessions. So in this meeting, we're hoping to re-engage your interest and to provide an overview of our institute, our research themes, and outline our programs. And we do want to highlight to you some engagement and funding opportunities. The most important thing is that we want to hear your feedbacks, and we do want to invite you to sign up as a member of IfP. So this is our agenda. We're going to talk about our institute, and I'll pass on to our theme leads to talk about the research themes, and we'll outline our programs, and hopefully at the end, we can have some time for discussion. Next slide, please. So let me begin with the land acknowledgement statement. We wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it's been the traditional land of Rwanda, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we're grateful to the opportunity to work on this land. Next slide, please. So this is our team. Under the leadership of Dean Brown, our founding director, we have a core team at the School of Public Health and 14 members strong steering committee. I myself is an infectious disease physicians with special interest in pandemics and epidemics, and we have our new associate director, Theodore Konya. So Ted, can you introduce yourself?
Hey everybody, I'm Ted Konya. I'm the new associate director for the Institute, started last month. In my role, I'm in charge of implementing all of our programming and activities.
All right. Sarah is one of our theme leads. Can you introduce yourself?
Sure. Hi, I'm Sarah Allen. I'm an associate professor of health policy at the IHPME in the Dalhousie School of Public Health. And I'm leading up the resilience theme together with colleagues Brian Bakery and Fahad Razak.
Jeff.
Hi, I'm Jeff Anderson. I'm a professor at Dalhousie School of Public Health. I'm a health services researcher and interested in the impacts of health and broader determinants of health on vulnerable populations. And my co-leads are Shauna Braille from the University of Toronto, Mississauga, and Simone Vigood from the Temerity Faculty of Medicine.
And David.
Hey, I'm David Fisman. I'm an epidemiologist and physician, and I'm leading the readiness stream along with Leah Cowan from, I think, molecular genetics, who's now our VP research, as well as Jeff Siegel from the Faculty of Engineering.
Thank you, David. You'll hear from them to describe their themes very soon. And also I'm very excited to tell you that professors from 6 participating academic divisions, and they are Faculty of Medicine, Engineering, Arts and Science, Rodman School of Management, University of Toronto, Mississauga, and the Faculty of Pharmacy. And actually, some of the names has just been mentioned. Our leadership team includes Professor Leah Cowan, Jeff Siegel, Fahad Razak, Brian Bragle, Shauna Braille, Simone Vigold, Sabine Austin, and Professor Anita McGahan. And they are joining us in this leadership team because it's impossible for us to do a round of introduction given this big group. So I'll suggest that you can make good use of our chat box function, and you can type in your affiliation and your research interest so that we can get to know each other a little bit more. So this is our governance structure, which is common to all ISIs, and deans from all the leading divisions as listed here, and the vice deans in research in these respective divisions will form the councils of deans and implementation committees respectively. And they will provide guidance, support the development of this ISI, receive reports, and approve annual funding to our 3-year program. Our steering committee, which I've just mentioned, will oversee the development of our program. And we're hoping that as our ISI grows, there will be more faculties from other divisions to join us in the leadership team. And I also like to point out that we are working very closely with another ISI, which is the IfP ISI led by the Faculty of Medicine, and their lead, Professor Scott Ray Owen, is also in our leadership team to provide his inputs. Next slide, please. So with this background, I just want to share with you our program. And actually, our institute was established in the very early phase of the pandemic. And at that time, it was one of the first academic centers dedicated exclusively to public health research and education on pandemic readiness, resilience, and recovery. Next slide, please. And our vision is to be a global leader in helping the world respond to pandemics, overcome infectious disease crisis, and prepare for future threats so that everyone, regardless of background or experience, can thrive. Our mission is to power interdisciplinary research, train future public health leaders in pandemic readiness, resilience, and recovery, and strengthen pandemic responses, policies, and systems in an equitable way that advance national and global health. Next slide, please. I will leave the details of our research themes to our leads, but I just want to point out that our ISI is focused on public health, epidemiology, and health policy. And we have also stated here that there's a transversal theme, which is health equity in pandemics, which is important to all 3 themes. And this will thread through all the areas that we will be working on. Our ISI emphasize on interdisciplinarity. I'm not going to read out all the disciplines that are involved in this ISI, but I'm glad to let you know that to date, IfP has engaged over 100 researchers from all these disciplines, and they are from 12 academic divisions and over 40 academic units within U of T. And we welcome all U of T faculties who are interested in pandemic research to join this initiative. Next slide, please. So I think that is a really busy slide. I'm not going to read to you every single word. I just want to show you here that we have got 3 pillars in this ISI. Briefly, for research, IfP is serving as a platform, linking and supporting researchers and global scholars across disciplines to develop collaborative projects and theme-based research programs. Under this pillar, we will have a Catalyst grant program, which aims to fund the development of collaborative interdisciplinary research projects, which we're going to discuss a little bit more in the coming slides. And there will be theme-based ideation workshops to cross-fertilize project conception and facilitate collaboration. For knowledge translation, IfP will translate and communicate scientific advances and innovations to health professionals government agencies, different community sectors, and to promote public education. So we're hoping that we can convene leaders in not only in academic, but in the public health, business, technology sectors to have a conversation. There will be speaker series, some of which are actually going on, and also activities related to communication, public communication, and health advocacy. And we are hoping to continue to develop our partnership with national and international public health agencies, as some of them are listed here. And one of our theme leads, Professor Jeff Anderson, will talk a little bit more on this as well. For training and education, we're hoping that IfP will serve as a unit to train and our future health leaders and provide education to students and health professionals, because a broad-based knowledge and a transdisciplinary approach is necessary to tackle the complex challenges of pandemics. So there are lots of things that's under active planning right now, but I just want to point out that there will be research training supports and also project awards for trainees, which we hope that we will have some time to present the details to you in coming slides. So the last slide, please. So just to sum up, the aim of our programs is to inform public health policies and interventions, translate research findings into concrete actions, and to better prepare or minimize societal disruption in future pandemics. So I think that because of the limit of time, I can just provide a very brief overview of our program. And now I will turn over to our theme leads to talk about the research themes. And the first one is the readiness theme, led by Professor David Smith. David, please.
Thanks. And I've mentioned who my co-leads are, so I could get the next slide. Yeah, so we have I don't think our theme is limited to what's on these slides, but a few things that are actively sort of active pursuits at the moment include ongoing work on mathematical modeling and surveillance tools related to infectious diseases broadly. We've done a fair bit of this. Folks linked to the IfP have done a fair bit of this throughout the pandemic, working with both provincial and federal and international, actually, collaborators, and we'll continue to do that. Next slide, please. There's tremendous interest, and I think this is where some of the cross-disciplinary research really may yield some big gains in modes of transmission and prevention, and particularly how our understanding of transmission has evolved during the pandemic. There's a whole bunch of innovation going on, not necessarily related to development of new technologies per se, but rather related to implementing technologies that we already have to prevent disease transmission in highly effective ways. There's a lot of interesting knowledge translation work to be done, for example, on low-cost air cleaners to prevent spread of viral diseases indoors. The mobility patterns, we dabbled in that in the past. I don't think I or anyone I know of who's working on IfP right now is doing mobility stuff. I think that's a carryover from an earlier iteration, but that's obviously always interesting, but less relevant right at the moment. Next slide. And then, as is probably obvious to many of you, as you look around at the WHO having an emergency meeting on Marburg disease in Africa, and all these crossover events for H5N1 and influenza from wild birds to a variety of other mammals. A lot of the interesting work in pandemic readiness happens at the human-animal interface. SARS-CoV-2, for example, is a bat coronavirus. So we have to be thinking about applying a One Health lens and thinking about humans and animals and environment, and how we build cities and how we produce our food and so forth, because that all is related to the genesis of pandemic risk. Of course, this is where some tension is likely to arise within the university. Of course, another way we generate risk is via risky lab research. And that's potentially something that I think we can have some interesting conversations around that involve not only laboratory scientists, but also folks from law and ethics and the humanities and folks with a bit of a historical lens and so forth, in terms of thinking about how to prevent the next pandemic without accidentally creating a future pandemic by doing unwise lab work. So that's it. I'll leave it at that.
Thanks, David. Sarah?
Thanks. I'll be similarly brief in presenting some of the areas of interest within the resilience theme that I've developed with my co-leads. So we can probably move to the next slide. And so the perspective that I'm taking when approaching resilience is from the health systems lens, but I know others will look at it differently and consider other actors and sort of pandemic resilience more broadly. But from the sort of health systems literature, we think about resilience as the ability for health systems to prepare, adapt, transform, and learn from shocks. And there's, of course, a connection between both readiness and recovery in terms of preparedness, but also, in learning from experiences and shocks to improve the system and society responses in future to support equitable recovery as well. So this is sort of the framing that I've taken and informs some of the work that we have underway. And in the next slide, I think I summarize here broadly what's captured in the first of 3 research areas. And this is understanding what we can do to strengthen resilience. And from a health systems perspective, again, we can look at system strategies and approaches from the looking at health system building blocks or functions and how they interact. And so here I've just provided a few examples of how you might look at each of these building blocks on its own, and then of course how they interact with each other. So these are illustrative examples only of things that I'm interested in and that our core team has been sort of developing some research around, but there's many other ways to approach these sort of strategies to improve resilience. And these are just sort of a launching off point. And then the second one is on the next slide, assessing pandemic. So looking back to see what happened and analyze the experience of the COVID-19 pandemic, to study the public health, economic, and health systems measures that were introduced and the decisions that were made, who was involved and what were the impacts, but really trying to learn from these experiences and considering questions like why things were done the way they were, and why does that matter? Some of the areas of focus that we're looking at is the role of science advisory mechanisms and how science and what constitutes evidence and what is the role of different disciplines, but also different perspectives such as communities and equity deserving communities in these decision-making roles and advisory mechanisms. So sort of a historical accounting of what happened to try and learn from and draw lessons for future pandemic resilience. And the third area is a broader one that sort of cross-cutting the other two, which is considering the roles and strategies for effective communication within and across the systems and with the public. And that could include, the ways we traditionally think about government and their role in communicating during crises, but also misinformation, disinformation, and how government and other public officials and authorities are engaging in trying to systematically address these challenges. But we're also really interested in the role of communities, the mechanisms to improve and strengthen the effective and equitable engagement of communities during pandemics, and learning from experiences of communities as well. And then final one touches on aspects of public trust in what? It could be the health system, it could be the decision makers, it could be the public health authorities, but that could be different depending on which one we look at. But how public trust is essential to building resilience, and what are the mechanisms to secure it could be through these other items that I've listed here around transparent decision-making, effective communication, community empowerment, and other strategies. So those are sort of the themes that we're considering here, and we're really excited to learn about the interests and work across the university on these areas. And then next steps, I'll leave really brief because we're going to be talking about next steps for the whole institute. But yeah, I'm really excited to hear some of your interests and to engage you in this work going forward. Thank you.
Thank you, Sarah. Jeff, please.
Okay, thanks, Nelson, and thanks to people for attending. So as Nelson pointed out, this ISI officially started in January, but we've been thinking about it under the leadership of Nelson and the Dean for probably a year or more. And what I'm going to do is try and describe to you our thinking to date with the notion that we want to engage you folks in developing these thoughts and engaging you and expanding them. So again, let me point out that my co-leads are Shauna Braille from UTM. She's an economic geographer, and Simone Vigod from the Temerity Faculty of Medicine. She's a psychiatrist. So if you go to the next slide. So our, we built this sort of vision statement for this theme. It's to monitor and understand pandemic's broader negative health impacts with a focus on inequities, and with the goal of developing evidence that can inform a roadmap to equitable recovery. So that's a lot to sort of take in there, but I'm going to try and go through some of the keywords in that. Again, it's our thinking at this point, and we certainly like your impact. So what do we mean? If you go to the next slide, what do we mean by the broader negative health impacts? So our theme is not working on the impacts of infection by the SARS-CoV-2 virus. We're more interested in health impacts that are mediated through other mechanisms, and mediated through mechanisms that in our public health field we call sort of the broader determinants of health. And so the idea is there that our efforts to contain the pandemic and the social stress caused by the pandemic itself may have had broad impacts on material and social circumstances for people. I think we all experience some of those. Your lives are radically changed, your interactions are radically changed for many people, their incomes are radically changed. So the idea here is that those impacts can have health effects. And the other one that overlaps a lot with the work that Sarah's team is doing is the fact that if you went into the pandemic and you already had a chronic disease like diabetes, what happened to the care you got for your diabetes and your ability to self-manage your diabetes during the pandemic? So the key point here is we're not interested in people who are infected with the virus directly. We're interested in people's health as it relates to our societal experience with the pandemic. So the next slide. And our goal here is very much to inform recovery. So we want to engage researchers across all the disciplines in the University of Toronto to get them to work together to see if we can identify interventions, policies, ideas that we think can address health inequities. And again, health inequities is an overarching theme here. And we really want to listen to direction for our research. And we want to engage the public in that, and ultimately want to engage decision makers. So we're very focused on informing recovery, which means we try and work with people who have their hands on the levers that guide societal policies and people's opportunities, and provide information to them that hopefully can inform them. Next slide. So again, we've been busy over the last year. We started in the spring with a opening workshop co-sponsored by the School of Cities, where we're trying to get an idea of listening for direction. We've been engaging with the Public Health Ontario, and of course, we're getting advice from the advisory board. We're looking today very much from advice from the folks on this call. We have been able to get some grants going. We had a CHR grant that involves many, involves UTM, OISE, Faculty of Medicine, as well as Dalla School of Public Health. As an extension of that, I'm part of a team led by Karen Chappelle from the School of Cities, who's got another grant that involves multiple faculty to look at the impacts on women and children of COVID containment. And we've done some work with the World Bank on, they just actually produced a report that we helped co-author on the disruptions in care in Latin America and the Caribbean. So we have some things going, but we're very interested in finding out what other folks have got going and how we can coordinate them. Next slide. So these are the three broad themes. Again, it just focuses back to what we said in sort of our mission. We want to better understand the broader health impacts. So what are those health impacts? The ones that aren't directly related to virus infection, again, mediated through changes in social circumstances. We want to focus very much on health inequities. So how are these health impacts distributed across different communities, particularly as Sarah said, equity deserving communities. And then the notion there is to ultimately all this is to build back better and fairer. So develop, evaluate and look into policies or ideas that could help us recover from this pandemic. So I think I just have one more slide. So, I think what we really want to do is create partnerships around accessing data to support our work. We're very quantitative. This group, again, that's where we come from, is tend to be a bit quantitative in nature. We're certainly willing to look at more qualitative research, but for now, many of the people involved are quantitative data driven. So one of their goals is to develop better access to existing data for all faculty across the university. I think that comes with a commitment to data justice and creating the data that we need. So if we're going to look at inequities, we have to be very careful about what data we use and how we engage the communities whose data we want to use. Key things are developing community partnership, again, particularly with equity deserving communities, and develop interdisciplinary research teams through the IfP. So I think that takes me to the end of my pitch, and I think you've all been very tolerant to hear about what the themes are up to. Thank you.
Thank you, Jeff. I would suggest that we have a very short pause here and to see if there's any quick comment or questions regarding our research themes before we move forward to describe our program, knowing that we do have some time for Q&A at the end of the session. So please feel free to raise your hands or just speak up. Looks like everybody is looking forward to hear Ted, to hear from Ted to describe the program. Oh, I see one hand.
And my apologies,
yeah.
I came in a few minutes late, so I may have missed this, but I wonder whether there are particular geographic areas of focus attached to particular themes, or because yeah, I heard in the last comment about Latin America and the Caribbean, but is the institute focused globally or focused more on the Canadian context? I wonder if somebody could provide a little direction there.
Jeff, do you want to take that question?
That's a very good question, and I think the idea is we're looking for opportunities in partnership across that full spectrum. So there is interest in global work, so that you could see the work with Latin America and the Caribbean. It turns out the other couple of grants I mentioned with the School of Cities, not surprisingly, are focused on cities as the unit of analysis. And we're looking at Toronto, London, England, and Bogota as sort of the cities. So I think we're open for many different types of geography. But right now, those are the two where we have the most work going on. Certainly interested if you have any other ideas about other people we could partner with.
Another hand, Gerald Penn.
Hi, thank you. I'm having a little bit of trouble putting real-time monitoring into one of the themes we've heard so far. Would that be under recovery or readiness or Sarah's theme?
Real-time monitoring of what, Gerald?
For example, case counts as they develop.
Okay, that sounds more like David.
David, do you want to comment on that?
Yeah, I mean, in terms of kind of near casting or uses of surveillance data, that's very much been an interest. I mean, we did a bunch of that stuff through the pandemic in terms of doing kind of quick and dirty models of what do trends look like, what do reproduction numbers look like. So I think that's very much within the scope of interests of people involved with the readiness theme. I think to some extent the SARS-CoV-2 data have probably been fairly meaningless since about summer of 2022, certainly in terms of Canadian data, which makes it much less interesting to try to work with them. But we certainly have access to a lot of historical data that we can use to develop utility people can use for surveillance and near casting for sure.
All right, great. Thanks very much.
What faculty are you with?
I'm in FAS in the computer science department.
Oh, great to meet you. Yeah, it would be lovely to connect.
Yeah, I'll be in touch.
Great, thank you. Because of interest of time, I think that we just allow two more quick questions, one from Amy Katz and the other one from Shaolin Wei. Please keep it brief. Thank you.
Me? Okay, thank you so much. My name is Amy Katz. I'm an adjunct professor at the School of Cities, and I'm also a knowledge translation specialist at St. Michael's Hospital. And I just had some questions about your partnership strategy. So you mentioned Public Health Ontario several times, and you also mentioned advocacy, and you've also mentioned health equities. And I think we've seen during the pandemic, especially with Public Health Ontario's guidance, for example, for long-term care homes and for congregate settings, that they left out indoor air quality measures like ventilation and filtration until June 2022. And there was a lot of advocacy to try and get them to put it back in. And eventually there was a little bit that went in, but Public Health Ontario sort of, I would say, generated a lot of health inequities during the pandemic and continues to, and I would maybe suggest partners like the World Bank might as well. So I'm just wondering how you're going to negotiate that and if that's a potential conflict of interest for you. So thank you.
David, you want to say something? You're muted.
Couldn't agree more. And I think in terms of linking, so we had a similar conversation last information session where I think people tend to sort of zoom out and say, what's the global view? What do you, what global organizations are you gonna be involved with? And I think that for us, there's so much that we can do just on campus by getting people who don't usually talk to each other to talk to each other, because there's tremendous diversity of knowledge and experience. And to your point, absolutely agree, ventilation is an equity issue, and it's an equity issue on which I think basically all public health agencies in Canada have dropped the ball. But what we have just on campus, and it's great to kind of virtually meet you. What we have on campus is we do have folks who are very interested in equity, but we also have engineers who are interested in making indoor air clean. And Jeff Siegel explicitly frames clean indoor air as an equity issue, and it is in Canada. I mean, you look at a 40-fold increased risk a lifetime risk of tuberculosis if you're Indigenous in Canada, that's not just bad luck, right? A lot of that relates to substandard housing and poor ventilation and how people live. So ventilation and indoor air is absolutely an equity issue. And it's not usually framed as such, and it's not usually perceived as such. But I think what's neat about IfP is we have the opportunity to actually link people who are interested in health equity to people who are interested in engineered indoor environments to change risk, to people who are interested in infectious diseases and how they move around. So I think it's a tremendous potential opportunity.
So actually, I'm keeping track of our time. I think that we do have time for further questions and comments at the end of the session. Please let us move on for now, and let's talk about the engagement opportunities, and then we'll come back to the Q&A. Thank you for your understanding.
Thanks, Nelson. Yeah, thanks, Nelson. So how are we going to accomplish all those objectives? There's various opportunities for engagement. And so the first main priority that we are working on is our Catalyst grant program. And so we're going to have 2 phases of funding. The first phase, we're going to have the official announcement at some point next month with submissions due in April. And so this is a Catalyst Research and Development grant where the aim is to provide seed funding to support collaborative interdisciplinary research projects, which represent a step towards the pursuit of more comprehensive applications to external funding opportunities. So we know the amount isn't very large. It's not meant to support a fulsome project, but it's to kickstart these interdisciplinary groups to potentially attain more funding later on. So we have $25,000 per grant for up to 1 year. But we have 21 awards available, which we're going to aim to try and spread out across the themes evenly. And then amongst the 21 awards, 6 of those are going to be jointly awarded with our partner ISI, EPIC. And the questions are on our research themes, which we'll talk about in a couple minutes. And what we're hoping for on the research team is obviously representation from distinct disciplines with priority given to cross-faculty divisional teams. And there will be a phase 2 funding some point later next year, which will be a little bit more at $50,000 per grant, aiming for priority to teams with the phase 1 experience. Eligibility for most of the IfP awards, the principal applicant needs to be a tenure stream faculty eligible to hold research funding at U of T. This is an ISI requirement for us. But with the EPIC IfP jointly awarded Catalyst grants, you can also include faculty that have a hospital primary appointment, and that includes clinical faculty within School of Public Health. And like I said earlier, the application should have 2 investigators from distinct disciplines, and we definitely encourage research teams that include trainees, even undergraduates. So we have 9 overall questions, 3 per theme. We'll just give a few minutes for each of the theme leads just to go over the expectations that they're hoping for with the projects in their theme. So David, you want to go over readiness quickly?
Sure. So here are 3 ideas that we came up with that we thought would be interesting. It's a little bit, slide's a little bit blocked by the Zoom window. There we go. So first thing, which I think relates directly back to the point that Amy made, is what are the health economic arguments and data that we can use to support an all hazards approach to mitigation of current and future indoor airborne infectious disease threats. This pandemic sort of taught us that we probably need to do for indoor air what our ancestors did for sewage between 1912 and 1917 in Toronto, which is we have disease threats that individuals, and again, to Amy's point, when Public Health Ontario or other health agencies say, here's how you manage your own risk, they're fundamentally missing the point in terms of how we achieve health equity, because disease transmission in indoor air environments relates to variables that individuals cannot control. You can't control the quality of the air you breathe. The institution needs to do that. The counter argument around indoor air and developing infrastructure is that it's expensive. So I think we're very interested in brainstorming around what the knowledge gaps are, what the health economic evidence base is around improving indoor air, and what are some of the, and we know what some of the highly effective and really inexpensive tools are that we have, and how do we scale that up? And that's not just going to protect us against COVID, it's going to protect us against the future bird flus of the world. So that's number one. Number two, I think I touched on this in terms of speaking at One Health earlier. What are the epidemiologic, governance, scientific, and ethical tools that we can use to balance the risk between preventing future pandemics via microbiological research, virological research, and the genesis of potential risks via doing risky research? So this is around issues like gain of function and engineering pathogens with pandemic potential. The ethical lines, what are the epidemiological concepts that we need to understand better? And then the last thing that I think is really important in terms of pandemic readiness, and you've just had a Royal Society report on this. I think people are starting to get how important this is, relates to disinformation, and how disinformation and the use of social media tools really made the pandemic as bad as it was, probably made it worse than it needed to be. And what tools and approaches can we use to protect against disinformation in future pandemics related to vaccines and other things as well?
Thanks. Resilience, Sarah.
Thanks. These are kind of copy pasted from my previous slides, so there's no surprises, but I will say that, while it seems narrow here, like question one with health system strategies, we could think about it more broadly, like what are the partnerships that may inevitably involve the health system but might not be sort of led by a health system, or considering private sector partnerships or community partnerships to sort of strengthen pandemic resilience. So these, if you have questions about whether your research fits, please send me a note, but I think these are basically a recap of the previous slides, and we've tried to keep them somewhat concise, but they are, basically mapping onto the three research areas that we've highlighted, allowing for some flexibility within them. And I think this is also where questions around I think Amy's question also resonated with me, even though we might have partners who we are engaging with in the Institute. The research may be very critical and may come up with information that is not openly received by these partners, but that's certainly welcome and likely outcome of some of this work as well. So I think I'll leave it at that.
Thanks. And Jeff, recovery.
Yeah, again, this I think reflects the themes we discussed when I was talking about the theme overall. I do want to make the point here, I think that we'd like to engage with people on each one of these. So I think there's sort of two goals of engagement. One is within the university, or across the university, if you want to think of it that way. And the other is intersections with other people who could either use this research or actively be engaged in this research. So, the first one is just trying to quantify some of these broader health and societal impacts of COVID. We've listed some there, and I think a lot of those grants could be around developing access to data and consortium with common interests about using data. The second one is very focused on equity and equity deserving communities, and clearly what we're looking for there, for anybody that wants to do these grants, is a strategy to engage with the communities of interest. So I think I raised the issue of data justice before, and the idea that if we're going to look into equity issues, we have to do it with the communities that are involved. So I think we would probably highlight in these grant calls the need to engage with the sort of the correct groups and populations. And the final one is what policy strategies and interventions could be developed. Again, I would think, and I think our theme co-leads have all agreed, if we want people to get one of these grants, they should probably engage with a decision maker from the outset. So the idea is to develop the grant as a product that's developed with someone who's going to use the information about these strategies and interventions. So I think this is less about the content of the questions and more about, I think, a plea for engagement.
Thank you. Yeah, so be on the lookout for the call out in March. We'll have time for Q&A later if you have questions specific to any of those research themes. So I'll just finish up with a few more slides on other engagement opportunities. We will be implementing a fellowship and studentship program, which aims to provide funding for interdisciplinary co-supervised postdocs, doctoral, and studentships. We don't know timing yet, but at least some point this year for these studentships. This is for graduate level students that are currently enrolled in U of T and would have at least 1 year left in their program. We're aiming for around 10,000 per award, co-disciplinary, and students would not be able to hold another major award at the time. And postdocs, similar concept with co-supervision, and we'll have any announcements about those programs when they roll out. There are various knowledge translation opportunities that are going to be coming up. We'll be having a speaker series in collaboration with the other ISIs, Climate Positive Energy and EPIC, in April, May, and June. On March 6th, there is a presentation on media messaging on equity, part of the Vora Miller lectures. I will add a link to that in the chat once Q&A starts. We will also be having IfP Symposia, where researchers that do obtain funding from us are able to present their projects, and we'll invite various partners as well. And presenting to IfP partners. So we mentioned the collaboration we have with PHO and any other partners we have, you could present research to them. Theme-led development of policy option papers, reports, and consensus guidance. And as always, we're open to any ideas and proposals from IfP members. So how to become a member. So there is a QR code here that you can use your phone to scan with your camera. I will also add the link in the chat momentarily. But the purpose of becoming a member is you get advance notification from us for grants and award call out announcements, personal invitations to symposia, speaker series, and other events. We will reach out to our membership as well for collaboration opportunities on large scale grant applications and those policy paper options that we were talking about, and an opportunity to connect with other IfP partners and collaborators. So we'll have a SharePoint site set up where you'll be able to view the membership and connect with others through that option. So I'm going to leave this slide up for now. Nelson, if you want to move on to Q&A so people can scan that if needed.
Well, thank you, Ted. So I think that we will have about 10 minutes for Q&A. I recall that Xiaolin has a question, and there is another one, but I didn't catch the name. Sorry about that. So please feel free to speak up.
Thank you very much. I think next one is Marine, who is hand up. So my question is that first introduction, I'm a professor and Dalai Lama chair in global health policy. I wanted to kind of bring a group of faculty here who is called the Global Implementation Science Cluster, which I co-lead with Erica. So because this group, we have different works regarding the themes we are talking about. For example, currently there's a trial in Pakistan to look at how to strengthen the hypertension diabetes care with the primary care providers during the pandemic. There's also another study co-developed the vaccine confidence using the faith-based organization in the Philippines. So that touches the part of the community engagement, disinformation, etc. And we have about 40 faculties and about roughly like 100 students from 2 clusters. Sarah is a big supporter to this and has been mentoring many. they work on the different fronts regarding the implementing science. But I think that it's a kind of methodology could be integrated into looking at the pandemic issues in different parts of the world. So I want to bring this group of people in because that will be very helpful. For example, for another grant, Sarah and I am on the grant is to actually prepare the AMR policies, population-wide policies in UK, Australia, China, Canada, and Pakistan. So there are lots of things we could cross-learn both kind of locally and globally. And it's very important to set up the picture from the beginning, as far as I can say. Thank you.
Thank you, Sally. You can use the chat box to provide more information if you want to. So Marianne, please.
Yes, thank you. Thank you very much. Thanks to everyone. I also especially want to thank Amy for her great question and David for his response. I'm an industrial hygienist, adjunct with occupational environmental health at Dalla Lana. So only have 1 foot or maybe a few toes in the university, but largely outside it. I am with a nonprofit called Workplace Health Without Borders, and also joined the Canadian Aerosol Transmission Coalition early in the pandemic, which has been raising the kind of questions David and Amy alluded to about lack of recognition of aerosol transmission and the kind of solutions that industrial hygienists have been advocating for from the beginning, namely good ventilation and good respiratory protection. So the coalition has been engaged in a process of consulting with various groups, including academics, but also largely community groups, healthcare groups, labor groups, on how to do, I think, a lot of what you're talking about, which is prepare for the next pandemic and deal with the ongoing one. And we're all volunteer, no funding. I think we're about to, maybe it's a classic case of chutzpah, but we're about to embark on some more intensive consultation meetings to try to see if there's some consensus around these issues, with the view to maybe consolidating some policy proposals. So it sounds a lot very much related to what you're doing. So my question is, what do you see as the opportunity for the Institute to engage with outside groups, maybe not from a research focus, but more from a community advocacy and engagement focus?
Maybe I'll respond to that. I think that is a great point. We welcome collaboration with organizations outside the university. I don't think there is any official channel for that, but so if you've got any idea, just speak with us, and we'll connect. We'll love to hear the opportunities.
Great, thank you.
Yes.
I'll just echo that, Nelson, in terms of the resilience theme. I think the applications for the Catalyst grants, for example, might be led by a faculty member, but they could include you or colleagues from your organization as collaborators and partners, and that would very much strengthen the application and provide unique perspectives. So, and that would sort of bump it up in terms of the things that we're looking for in evaluating these. So I think this, given your interest, and you can see some of the groups, some of the people names here, and you'll be connected with them formally through the distribution list. So I encourage you to reach out where you see people who are working on areas they'd like to contribute, and similarly faculty might reach out to you given your interest in partnering on these grants.
David, please unmute.
Sorry, our number one on the readiness list looks like a slow pitch up the middle for the Canadian Aerosol Coalition, in terms of all hazards models for indoor infectious threats. I mean, that's what you've been thinking about that for some time, longer than I have, for sure. It does seem like a great opportunity to get people talking and working together in their Catalyst grants. I mean, it's not $500,000. It's a grant to get people together and brainstorm and sort of start building foundations.
Thank you.
Thank you. Any other question? As our theme list has pointed out, our ISI, it's serving as a platform for people to connect. We welcome ideas, both inside and outside the university, and we would love to connect with people in different areas, including thought leaders in the community. So please reach out to us. It's impossible for us to know everybody, but we would love to build those connections. And one of the first things that I would like to remember everybody who attended this session is that please consider signing up as a member so that we'll be able to get connected with you. Ted, do you have any information to provide to this group about membership? And
I put the link to the membership form in the chat. But yeah, so once I have the full list of members, then I will add everybody to our SharePoint site. We will get information there, general information, and we'll have news and events listed throughout there. And we'll email the membership list first regarding the Grant Catalyst Call Out program before it goes to the university-wide research alert. So you'll have an opportunity to get the heads up of it then.
Thank you. It's a very user-friendly membership application form. So please consider. So we're actually 2 minutes early. If there's no further question, we can adjourn the meeting. And I wish you all a great weekend, great long weekend. Thank you very much for being here.
Thanks.
Thanks.
Thank you.
Thank you.